Hello, this is Sudharshan, and in this episode, we'll talk about chapter 29, bloodstream infections. As the name itself tells, these are the infections that arise in the bloodstream. So mainly emia suffix is very important with the organisms that infect the bloodstream, like bacteremia, viremia, fungemia, parasitemia, etc. So let us see the different agents responsible for BSI or bloodstream infections. First, bacteria. We will divide into gram positive and negative. Under that we have cocci, bacilli. Those were spherical and those were rod shaped. Now coming to the gram positive ones. Okay, or first let us see with the cocci, which are gram positive. Okay, with the gram positive cocci, we have streptococci, staphylococci, etc. So in case of the bacilli gram positive, we have this bacillus anthracis and listeria. With respect to gram negative, let us see. In the gram negative cocci, we have meningococci, and with the gram negative bacilli, we have the E. coli, Klebsiella, Enterobacter, etc. And with the viruses, very common of all is HIV, apart from that CMV, cytomegalovirus, then EBV, Epstein-Barr virus, parasites very commonly malaria, and that is Plasmodium and Babesia, then Leishmania. And with fungi, we can have the Candida, we can have Blastomyces, we can have Histoplasma, Cryptococcus, etc. And then let us come to one important one, that is FUO, fever of unknown origin. As the name suggests, it is a fever which is idiopathic or of unknown cause. So with respect to the causes which we have, most commonly certain infections, as we have seen, different microbes. Apart from that, we can have some tumors like lymphomas, leukemias, myelomas, etc. Some autoimmune diseases like SLE, rheumatoid arthritis, etc. Okay, so with the different changes which we can see in FUO, so when there is an infection, WBC, ESR, CRP, and other blood cell counts are elevated, and there is elevated kidney and liver enzymes. Apart from that, the muscle enzymes like CPK, LDH, they are elevated. Different other factors like RF, rheumatoid factor, or anti-citrullinated peptide, anti-nuclear antibodies, all these. And with respect to the diagnosis, sample collection can be done based on the site affected. Then we can do a culture as well in different media, and then we can do serology. In that, antigen antibody testing can be done, and then we have some automated techniques and imaging techniques can be done. Then we can do a blood test, we can assess the ESR, and treatment would be supportive care with empirical therapy. So that is all with the bloodstream infections. So thank you so much. We'll see you in the next lesson.